Welcome to Compass and Clock. I'm your host, Mary Copeland. This infotainment podcast explores how to live your best life now and well into retirement. We'll discuss topics in financial planning, housing, and insurance. We'll talk wellness, relationships, and leisure activities. A full active life requires planning for your goals and preparing for the unexpected. I'll introduce you to a variety of guests, from knowledgeable experts to folks sharing stories of their life experiences and so much more. Because life is big. All is intended to help guide you in planning for what you need now and at any age. Like and subscribe so you don't miss a thing. Today, my guest is Dr. Brian Kovara, owner of Living Well Bainbridge, which is a wellness center. And for the past 25 years, his patients have been calling him Dr. Brian. But when he's not relieving somebody's pain, you can find him walking his dog or spending time with his two girls or having a cuppa with his lovely wife, April. Brian, welcome to the show.
Thank you for having me, Mary. I'm excited to be here and looking forward to share some information with all of your guests.
Yeah, fantastic. And I probably should have said, Dr. Brian, welcome to the show. So, um, but all that information you're going to share, what we're going to talk about today is I'm going to ask you to explain what decompression therapy is and how it's a non-surgical option for those with back pain and knee pain, etc. So why don't we just jump right in and start at the beginning? Can you tell us what is chiropractic care?
Yeah, great question. So a lot of people think of chiropractors as back specialists or neck specialists, and those are a lot of the things that we see people for. But really, what we're focusing on is the nervous system, and the spine is the main protective armor around our central nervous system, which is the most important system in our body because it controls everything. And so chiropractors are trained to analyze the alignment of the spine to check for misalignments of the vertebrae that may be causing pressure to the nerves, which can cause a variety of different symptoms stemming from pain to all kinds of different functional problems as well.
And everything like connects off of that, right? Your spine goes down your back. And so when you're making sure that's in line, it could be affecting a knee or a shoulder or some another part of your body, correct?
Yeah, the old song, the knee bone's connected to the hip bone's connected to the pelvic bone, and it's there's a lot of truth to that. So everything is connected, and the body actually works from top to bottom, inside out. The brain talks down the spine and then out through the nervous system, and so all those little nerves are kind of like a circuit breaker in your house. So if some of those circuits get thrown wherever that nerve is going, it shuts off the power to that part of your body. So chiropractic can be amazing for a lot of other uh, conditions that you necessarily wouldn't think of. So
Yeah. Thanks for breaking it down and with that analogy. Makes it a little
yeah,
more understandable. Yeah.
sure.
So now let's talk about pain. What is pain really? How conceptually, or what is pain in your when it comes to your practice?
Yeah, so pain is a perception. So when there's something wrong in your body, your brain perceives that area as pain, and there's different nerve fibers that control the muscles in your body. They control the sensation in your body, and then there's also nerve fibers. So out of each of those nerves that come out from your spine, they have different roles. And so what we're looking for is those misalignments that could be putting pressure on the nerve that would tell your brain that something hurts. So that's really a simplified way to talk about what pain really is.
Okay. But somebody comes into your clinic and they say, my knee hurts. There's
Hmm.
probably different levels of pain there too. You probably ask questions about the pain. Is that correct?
Yeah,
Okay.
absolutely. Yeah. So pain can be acute or it can be chronic, which means it's either short term or long term, right?
Mhm.
Um, it can also originate from different parts of the body. So there are nerves from the lower spine that go down into the legs. And so even though you might have pain in your knee, it could translate up to a lower back or pelvic problem. So, one of the things that we like to do is to be very thorough with our evaluation so we can try to find where the root cause of the pain is coming from, so then we can properly treat it and correct it so it doesn't continue to give you problems in the future.
Well, that leads into my next question then. What's the next step? Someone has pain. Where do they go from here? Do they need to get a referral, to be working with your office, etc.?
Yeah, no referrals are necessary to come and see us. So we do generally do a 2-day process. So the first day we're going to ask a bunch of questions about it. So we do a consultation to find out more about what's going on, and then we'll do an examination of the area. Okay. And then from there, I like to get x-rays because x-rays not only help me to confirm what I'm feeling, but make sure I'm not missing anything. And
Mhm.
so from there, we'll schedule a follow-up time to allow me the proper time to read the x-rays and go through my x-ray findings, and then formulate a treatment plan. And then I present the x-ray and then the treatment plan on the next appointment. And that's when we would get started on treatment.
Okay. So, what are the different treatment plan options based on where their pain is in your assessment?
Hmm. Yeah, so we have obviously I'm a chiropractor, so we do chiropractic treatment to restore the alignment. And then we have all kinds of different modalities to use to help heal tissues and to speed up the healing process so we can get you feeling better as quickly as possible. So we use something called class 4 laser that's really powerful at decreasing inflammation and pain. So we oftentimes will incorporate that in along with decompression therapy. So we have ways to decompress the spine or the knee. And so a lot of the times we'll incorporate some of those additional modalities depending on what we find with the exam and with the x-rays.
So, I have not been to a chiropractor in my entire life. I must be one of those lucky few that really have not experienced pain. But, I think of chiropractic care and I think I'm laying on a table and somebody's kind of massaging me and stretching me or whatever. So are those plan options, treatment options? I mean, is that really happening?
So usually chiropractic involves some type of a what we call an adjustment. That is the treatment that chiropractors do to correct for the spinal misalignments. And that can be done a number of different ways. You can use your hands to manually manipulate. That's the way most schools teach it. And then there's also tools and instruments. There's different tables that you can use to make those adjustments as well. So there's a number of different ways. And it really how we determine which way is best is you know through the exam, through the x-rays, kind of figuring out, do we need to be more aggressive or more gentle, and so all those things kind of factor into my decision as far as what type of treatment to start with, and then we just dial it in as we need to.
Okay. And one of the treatment plans that you mentioned was decompression, which was one of the reasons that we're having this conversation today, because I find it fascinating and did not know about it. So I figured let's share it with other folks out there. But can you break it down and tell us more about exactly, actually what decompression therapy is?
Yeah, decompression therapy has been an amazing addition to our practice. So um, when we go through the evaluation process, if we determine that there's a problem with the disc, so you've got a little spacer, a little pad that sits in between the vertebrae, and its job is to cushion the bones so the bones aren't pressing on each other. And it also creates room in for the nerves to leave the spine. Now, if there's a problem with that disc being bulging or herniated, or over time as we age, oftentimes it can uh, do what's called degeneration. So the disc gets smaller, the space gets smaller, and that's due to time and gravity. So those forces push our spine closer together or compress our spine. So what decompression therapy is a way to reverse that. And so we would have you on a table or a chair, and it creates a slow, gentle tension that distracts or separates that part of either your spine or your knee joint, where we're trying to create a increase in space there or decompress that part of your spine.
And is there movement with this? Is the patient moving, or what is actually happening?
Yeah, so for the spine, you're laying down comfortably on your back, and then you if we're doing like your lower spine, there's going to be some belts across your waist, and then it's all computerized. So we enter in a certain amount of tension, and then the machine slowly and gently pulls and separates the spine. It feels amazing. Everybody that uses it, raves about it. We have people that doze off and fall asleep on it. Probably several times a week it happens. And then with the knee chair, you're going to be sitting up, your legs in a very comfortable position, and then it slowly and gently stretches the same way. So there's some straps that will allow us to focus on the right angle of the knee, and then it slowly and gently pulls and separates just like it does with the spine.
Okay. So with this decompression therapy, can you tell us some of the specific conditions that this therapy can help with?
Yeah, so it's great for treating, like I said, disc problems. So, if somebody has been diagnosed with a disc herniation or degeneration or a disc bulge, those are all potential great candidates for what we do. Sciatica is another real common one that is very treatable with decompression. Um, you may have radiating pain from your neck into your arms or fingers. Numbness or tingling in the hands or the feet is also another condition that we see quite frequently. So there's a lot of different conditions that the decompression can be really, really successful for.
Um, and I've heard of sciatica before, but these are terms that you deal with all the time, but I'm a layperson. I don't. So can you elaborate a little bit more on what these conditions really are?
Yeah, sure. So sciatica is a condition where the sciatic nerve, which is the largest nerve in your body, and it's actually comprised of four different spinal levels that come together to form that large nerve fiber. And it leaves the lower back, travels down the buttocks, the back of the leg, down to the bottom of the foot. So somebody who has sciatica could have pain in the lower back, they could have pain in the buttocks, they could have pain in the back of the leg or down into the lower leg and foot. So um, that's one of the more frequent conditions that I see, just because it's such a prevalent thing out there, and we get great results with it.
And are these different conditions, whether they're connected to back pain or to knee pain? Are you seeing these more, you and other chiropractors? Is it an age thing, or is it doesn't matter what your age is, you could be affected by these different pain conditions?
Yeah, so I think the more chronic conditions tend to be more frequent with age, just because you have more time and the more likelihood that you've had traumas or repetitive stressors that cause the body to wear down.
Mhm.
But we do see acute conditions where people have an acute trauma, like an accident, or they lift something too heavy and they have a herniated disc or something from that. So it's not just an age related problem. It can happen with people in their 20s and 30s as well. So um, yeah, it kind of goes both ways.
And would you say it also, you see patients maybe that are playing sports, um, like a soccer player, for instance, it's a repetitive sport with what they're doing with that activity. It probably has a lot of wear and tear on their knees, or even,
Absolutely.
yeah, okay.
Yeah. Yeah. So yeah, you think about, the sport or the occupation even. The areas that you're, repetitively stressing, those are the ones that tend to wear down. So, nowadays there's so many people working on computers and, even from home remotely, that they're spending a lot of time on a laptop. And so they will start to develop problems in their neck. They might develop headaches from poor posture. They could develop lower back problems because they're sitting too much now and they're not activating those different posture muscles. So, um, you know, that's that's a real common thing that we're seeing nowadays with technology being so widespread.
Can you use this decompression therapy for both acute and chronic pain, or is it really meant for one more than the other?
You can use it for both. So there's different settings that we as an office know how to set the table slightly different for an acute case as opposed to a chronic case. So the table will pull slightly different with acute as compared to a chronic situation. But yeah, you can treat both acute and chronic problems with it.
Um, One of the things too that we talked about in the beginning of our conversation today was how this decompression therapy is a non-surgical option. So when you say non-surgical option, are you saying, hey, there's a chance that, if you've been considering a knee replacement, you might want to try decompression therapy? Can we go down that road?
Absolutely, yeah. So, it's considered conservative treatment, so it's non-invasive, it's
Mhm.
non-surgical, right? So, but the the success rate is really high for treating these disc problems or the knee problems that could prevent you from needing to have that surgery, because any type of surgery there's a risk that comes with it, as simple as the surgery may seem. If we can do anything to help people avoid having surgery, then we're doing our job.
And when we talk about these treatment plans, can you go a little deeper into that too? I mean, I don't want people to walk away thinking, okay, they're coming into your practice or another practice and they get on this machine, and they have three treatments maybe, and then they're miraculously recovered. How does it
Mhm.
actually, can you talk me through that?
Yeah, so usually if we're doing some type of a plan, you might be coming in a couple times a week, 2 to 3 times a week for a while. We always reevaluate you through the process to make sure that things are improving. Um, and so when we do the initial x-rays, that really helps me dial in how much treatment you might need and then how long we can expect before correction takes place.
So somebody comes to your practice, let's say they have a knee pain and it's a chronic knee pain and they want to
Mhm.
try this decompression therapy as opposed to having a knee replacement. Could this be something where they see you for a couple of years or a couple of months? How do, you know, what would what what's the take on that?
Yeah. So a typical corrective plan might last, 3 to 6 months. Um, once things are fixed and at a good, healthy place, um, a lot of our patients choose to do what's called maintenance just to keep their bodies healthy and to make sure that everything is staying, where we have it at that point when it's corrected. Um, and so people tend to do that for as long as they like. Yeah, it's kind of like going to the dentist for your, annual or your 6 month checkups, or going to your physician for your annual checkups. Spinal health is, in my opinion, is equally as important as any of those other conditions. And so we always recommend people have their spinal health checked.
Yeah. And when you talked about the decompression therapy and the machine is set, to at different levels based on the person's um, condition, etc. It sounded like you talked about rejuvenation, so to speak, where it recovers itself? Can you go?
Yes. So sure. Yeah, I'd be happy to. So when there's compression to the spine, what happens is it pushes the fluid or the nutrients out of the disc. I compare it to a sponge. If you've ever compressed the sponge or pushed down the sponge, it pushes out all the water. And then as you lift that pressure off there, you notice that it draws the water back into the sponge. So our discs are very similar. If there's compression or there's pressure down on that disc, it's going to push everything out. Whereas if you decompress it or you reverse that pressure, it draws the nutrients back in. And so that's what helps to create the space and plump up those discs again for you.
So if I'm understanding you correctly, before somebody is undergoing decompression therapy, the disc is in a deflated sponge, like you just squeeze the sponge out and it remains like that. But then they get on this machine with you, and then that disc is expanding and closing and expanding, doing what it's supposed to do. You're bringing it
That
back
is absolutely correct.
to speak. Okay.
Yep, exactly.
Okay. Um, I feel like I don't know if I've asked you all the questions. Am I missing anything that you would want to, like, if you wanted our listeners to walk away with one or two things from our discussion, what would those be? And you have a little bit of time to elaborate on it. You don't have to tell us quickly. Just do it in lay terms for us.
Yeah, I think the big takeaway is if you've been diagnosed with a disc problem or a chronic, knee arthritis, even bone on bone, these are potentially treatable things that we can take care of in our office that don't require surgery. And, the results are much quicker as far as like your recovery time. You don't have to worry about, months of rehab after having a knee replacement or having a back surgery. These are things that we can get movement back into your body much, much quicker and help people regain quality of life, get them back doing the things they want to do, playing with their grandkids or getting back into uh, activities. Pickleball is so popular now. And, I have tons of people that are pickleballers. And if I can keep you playing pickleball, that I'm winning, I'm so happy because I love pickleball myself. I've gotten into it and it's just such a fun sport, and seeing people able to play it again that, have had to sit on the sidelines for a while. It's so rewarding.
Yeah. And it seemed to me that a comment that you made earlier would be one of the big takeaways on this conversation too, which was you said just like people get their annual physical each year, they go to the dentist and get their teeth cleaned twice a year. Um, they should get spinal, um, uh, what would you call an annual spinal check?
Spinal checkup, yeah. Yeah, spinal checkups are great, because a lot of times you could have a spinal misalignment that is maybe causing blood pressure problems, or it's causing digestive issues, and you don't necessarily relate it to a spinal problem, but as a chiropractor, we're trained to detect that, right? And so we could potentially help with some of those functional things before a pain sets in. And so a lot of the times, we can help to find a problem and fix it before it develops into something symptomatic.
And so, a spinal checkup, what exactly is that? Is that where you do an X-ray? Is that where people move around? What is a spinal checkup?
Yeah, likely that would be, we would assess their posture and their range of motion, their ability to bend and move. And then x-rays are always helpful, just, because it gives a more complete picture as far as how healthy a spine is and if there's any wear and tear in certain spots. So you can be a little bit more specific with your treatment plan and any other additional treatment options that you might want to include.
And again, if you want to get a spinal checkup, this is not something you need a referral for. You can just do your due diligence, find the best chiropractor for, in your area for your care, and ask if, do all chiropractors do spinal checkups?
Most chiropractors should do spinal checkups. Yeah.
Okay, good.
Yeah, but not everybody's going to do decompression. Not everybody's going to do X-rays. Not everybody's going to do laser. So, I think if there, I was going to say there's some things that would separate me from, my my chiropractic colleagues in the community. It's that we have a lot more tools and technology at our disposal to uh, offer a more well-rounded treatment plan.
So it sounds like what our listeners should walk away with is ask questions, ask the chiropractor that you're researching that you might want to work with. Do you offer decompression therapy? Do you do spinal checkups? Do you do laser treatments, adjustments, etc.? Not just, the TV show Two and a Half Men adjustments. And that's all the chiropractor.
That's right.
So, okay.
Yeah,
Well, I'd have to say thank you so much, Brian. Your expertise really helps myself and our listeners um, learn more about our body and when it's talking to us in pain and finding out that there's non-surgical options out there when people are thinking, oh no, I'm going to have a knee replacement or whatever the case may be. That's probably very relieving for our listeners right now. So thank you for joining us and listeners. Until next week, you take care and thanks for listening. Bye-bye.
bye. Thank you for having me.
Thank you, Brian.